Hello everyone. Today in the part 3 of the NEET PG important questions, we will discuss about the important question and the answers that may ask in the NEET PG exam. And today's topic is about the cranial cavity. So just make sure that you just read out the cranial cavity topic, before going into the questions ahead. Okay, now we'll go on with the questions. Just try to solve the questions out by yourself first, and then of course I'm going to give you the answers. But just try to solve the questions by yourself first. Okay, now first of all, in the adults, bones of the skull cap are actually having, remember, 3 layers. That is the outer table of compact bone, middle layer of spongy bone called as the diploe, and the inner table of compact bone. In the children, bones of the cranial vault is actually having, remember, single layer. While the adults, it is triple layer. Anterior cranial fossa is actually formed by, remember, frontal, ethmoid and the sphenoid bone. Structure passing through anterior ethmoidal foramen are, remember, anterior ethmoidal nerve, branch of nasociliary nerve, anterior ethmoidal artery, which is a branch of ophthalmic artery, and the anterior ethmoidal vein, tributary of the ophthalmic vein. Structure passing through the posterior ethmoidal foramen are, remember, posterior ethmoidal nerve, branch of nasociliary nerve, posterior ethmoidal artery, branch of ophthalmic artery, and the posterior ethmoidal vein, tributary of the ophthalmic vein. Now middle cranial fossa is actually formed by body of sphenoid, greater wing of sphenoid, petrous temporal bone and the squamous part of the temporal bone. Keratoclinoid foramen or canal may be formed by anterior and middle clinoid processes. Superior orbital fissure is bounded by body, lesser wing and the greater wing of the sphenoidal bone. Foramen rotundum leads to which fossa? It is the pterygopalatine fossa. Now structure passing through the optic canal are optic nerve, pia mater, arachnoid mater and the dura mater, ophthalmic artery and the sympathetic plexus. Structures passing through the superior orbital fissure via the ring of Zinn are the oculomotor, abducent and the nasociliary nerve. Structures passing through the upper lateral part of the superior orbital fissure are trochlear, frontal and the lacrimal nerve. Structures passing through the inferior part of the superior orbital fissure are inferior ophthalmic vein. Structure passing through the foramen ovale are mandibular nerve, accessory middle meningeal artery and the lesser petrosal nerve. Structures passing through the foramen ovale are mandibular nerve, accessory middle meningeal artery and the lesser petrosal nerve. Posterior cranial fossa is formed by sphenoid, temporal, parietal and the occipital bones. Structures passing through jugular foramen are, so over here remember, from the anterior part, inferior petrosal sinus, from the middle part, 9th, 10th and 11th cranial nerve and from the posterior part, sigmoidal sinus. Structure passing through the anterior condyle canal are 12th cranial nerve and meningeal branch of the ascending pharyngeal artery. Anterior part of foramen magnum gives way to apical ligament of Dens, upper part of cruciform ligament and the membrana tectoria. Posterior part of foramen magnum gives way to medulla oblongata with spinal root of accessory nerve, 1 anterior and 2 posterior spinal arteries and 2 vertebral arteries. Venous sinuses enclosed in falx cerebri are superior sagittal sinus, inferior sagittal sinus and the straight sinus. Venous sinuses enclosed in the tentorium cerebelli are transverse, inferior petrosal and the straight sinus. Venous sinuses enclosed in the falx cerebelli are occipital sinus. Supratentorial dura is supplied by ophthalmic nerve, maxillary nerve and the nervus spinosus. Dura mater in anterior cranial fossa is supplied by anterior and posterior ethmoidal nerve and the maxillary nerve. Dura mater in the middle cranial fossa is supplied by maxillary nerve, recurrent branch of the mandibular nerve. Dura mater in the posterior cranial fossa is supplied by meningeal branch of vagus nerve, meningeal branch of hypoglossal nerve, cervical number 1 and cervical number 2, and the cervical plexus. Now, which are paired and unpaired cranial sinuses? So, the paired ones are cavernous, superior and the inferior petrosal, transverse, sigmoid, sphenoparietal, petrosquamous, middle meningeal sinuses. Unpaired are superior and the inferior sagittal sinus, straight, occipital, anterior and the posterior intercavernous sinus, and the basilar plexus of veins. Now, roof of cavernous venous sinuses is actually formed by meningeal layer of the dura mater. Floor of cavernous venous sinus is formed by endosteal layer of dura mater. Lateral wall of cavernous venous sinus is actually formed by meningeal layer of dura mater. Medial wall of cavernous sinus is formed by body of the sphenoid bone. Anterior wall of cavernous venous sinus is formed by superior orbital fissure. Posterior wall of cavernous venous sinus is formed by petrous part of temporal bone. Now next is, what is the relation of the cavernous venous sinus? So over here remember, superiorly there is optic chiasma and the internal carotid artery. Inferiorly foramen lacerum, laterally temporal lobe of the cerebrum, medially pituitary gland and the sphenoidal air sinus, anteriorly superior orbital fissure, and posteriorly apex of the petrous temporal bone. So remember this diagram, you will be easy able to remember the relation of the cavernous venous sinus. Now the structure passing through the lateral wall of the cavernous venous sinus are maxillary branch of trigeminal nerve, ophthalmic, trochlear nerve, and the oculomotor nerve. Structure passing through the central part of the cavernous venous sinus are abducent nerve, carotid plexus, that is the post ganglionic sympathetic nerve fiber, and the internal carotid artery. Now tributaries of the cavernous sinus from the orbit and the tributaries of cavernous sinus from the meninges are, so just remember this diagram. From the orbit there are superior ophthalmic vein, inferior ophthalmic vein, and the central vein of retina. From meninges, sphenoparietal sinus and the middle meningeal vein, and from the brain, superficial middle cerebral vein and the inferior cerebral vein. So remember this diagram, it is easy. Now which is the deepest cranial fossa? It is the posterior cranial fossa. Communication of the cavernous venous sinus are, so pterygoid sinus, internal jugular vein, and the transverse sinus. Most commonly fractured cranial fossa, it is the middle cranial fossa. Large diploic vein, it is the occipital diploic vein. How many total venous sinuses are actually present? These are 22 in number. Tributaries of superior sagittal sinus are inferior ophthalmic vein. Tributaries of sigmoid sinus are mastoid and the condylar vein, cerebellar vein, and the internal auditory vein. Now over here, this is the bonus picture. Over here, remember, in this particular picture, almost all the brain sinus of almost all the cranial sinus are actually given. Just remember this particular diagram. I know the sinuses are actually difficult to remember, but just remember this particular diagram, so it will be easier for you to remember all the sinuses of the particular cranial part. Okay. Now let's discuss this diagram in short. Over here, as you can see, this is superior sagittal sinus. This is the inferior sagittal sinus. Now over here, this two internal cerebral vein. Okay, this intercerebral vein actually combines, okay, and drains into the this great vein of Galen. Now this great vein of Galen and the inferior sagittal sinus actually drains into the straight sinus. Okay. Now the straight sinus, okay, and the superior sagittal sinus actually merges at the confluences of the sinus, this area. From this confluences of the sinuses, this particular straight sinus and the suprachiasmatic sinus actually drains into the transverse sinus. Okay, and over here as you can see, this particular transverse sinus continuous as the sigmoid sinus. Okay, and the sigmoid sinus actually drains this particular superior and the inferior petrosal sinuses, and this particular sigmoid sinus then finally drains into the internal jugular vein. Okay, now over here, this particular superior ophthalmic, inferior ophthalmic vein, etc. actually drains into the facial vein, which further finally drains into the internal jugular vein. So just remember this diagram. This diagram is actually very easy to remember the sinuses. So today up till here, we'll discuss about the further questions of the further next topics in our next videos. Thank you so much.